Welcome back to my stand-up channel. Boris Johnson has admitted, NHS waiting lists will get worse before they get better, after announcing a 1.25% tax rise from April. The PM broke an election promise today as he confirmed a £36 billion tax raid to address the funding crisis in health and social care. The Tory leader pressed ahead with his plan. Despite widespread backlash from senior Conservatives and warnings the move will place an unfair burden on low earners. It comes after an extra £5.4 billion funding package was announced to help the country's health service tackle COVID and the huge backlogs created by the pandemic over the next 6 months. More than 5 million people are currently waiting for treatment in England alone, the highest number since records began in August 2007. Speaking at a press conference this afternoon, Mr. Johnson said, "I have to level with people. Waiting lists will get worse before they get better. But, compared with before COVID, by 2024 our plan will allow the NHS to aim to treat 30% more patients who need elective care like knee replacements or cancer screenings. A recovery on this scale cannot be delivered by cheese-paring budgets elsewhere. It would be irresponsible to cover a permanent increase in health and social care spending with higher day-to-day borrowing. The tax rise will raise around £12 billion a year, which will mainly be used to fund the NHS backlog. It means someone earning an annual salary of £24,100 will contribute £3.46 a week, around £180 per year. A typical higher rate earner on £67,100 faces paying £715 more annually. No Conservative government wants to raise taxes, but the costs could not have been met through borrowing," the PM told the public today. He said, "This new levy will break our manifesto commitment, but a global pandemic wasn't in our manifesto either. Everyone knows in their bones that after everything we have spent to protect people through that crisis, we cannot now shirk the challenge of putting the NHS back on its feet." Meanwhile, Sajid Javid said the majority of the money raised will go into the NHS to fund continuous routine surgeries and new equipment to better detect diseases including cancer. The Health Secretary added, "Around 1 in 7 people end up spending over £100,000 on their care. From October 23, no one will have to pay more than £86,000 in care costs over their lifetime. That cap will be there for everyone regardless of any conditions you have, where you live, how old you are or how much you earn. No one with assets under £20,000 will have to make any contributions from their savings or housing wealth. And that's up from £14,250. Anyone with assets between £20,000 and £100,000 will be eligible for some means-tested support." Source: metro.co.uk. Please like, share and subscribe. Thank you for watching.